Welcome to the YouTube channel Dr. Mai, sharing medical knowledge. Today, we're diving into a fascinating and crucial topic for your health: vasoconstriction. We'll explore how it works, why it happens, and when it can become a problem. Before we begin, please take a moment to subscribe to the channel, like this video, and comment below to help us grow and continue bringing you insightful health content. What is vasoconstriction? Vasoconstriction refers to the narrowing of blood vessels as the smooth muscles around them tighten. This reduces the internal space, or lumen, through which blood can flow. Think of your blood vessels like a garden hose. If you squeeze the hose, the space inside becomes smaller, and water pressure increases. In a similar way, vasoconstriction increases blood pressure inside the vessels, which is sometimes necessary to maintain bodily functions, but can also be dangerous if it occurs too frequently or excessively. This process is regulated by the vasomotor nerves, part of the sympathetic nervous system. These nerves send signals to the muscles in your blood vessels, telling them when to contract or relax. Vasoconstriction can either help or harm you, depending on the context and how much it happens. Why does vasoconstriction happen? One of the most common and beneficial instances of vasoconstriction occurs when you're exposed to cold temperatures. Your body naturally reduces blood flow to your skin through peripheral vasoconstriction to prevent heat loss. This keeps the warm blood near your internal organs, helping to protect you from the cold. However, this function becomes less effective as we age. Older adults may have reduced ability to constrict their blood vessels in response to cold, leaving them more vulnerable to hypothermia. Medical conditions and treatment. Sometimes, doctors induce vasoconstriction on purpose using medications, especially in treating certain medical conditions. These include shock. Vasoconstriction can increase blood pressure in patients experiencing a sudden drop in blood flow due to shock. Rosacea. Some topical treatments for rosacea help by reducing blood flow to the face. Migraines. Medications for migraines sometimes use vasoconstriction to reduce blood flow in certain areas of the brain, easing headache symptoms. Asthma and COPD. Some inhalers for these conditions contain vasoconstrictors to open up airways. Glaucoma. Certain eye drops induce vasoconstriction to reduce pressure in the eyes. Interestingly, even some over-the-counter medications like nasal decongestants use vasoconstriction. These reduce swelling in the nasal passages by tightening blood vessels, helping you breathe easier. However, people with high blood pressure should be cautious about using decongestants, as the vasoconstriction they cause can spike blood pressure to unsafe levels. When vasoconstriction becomes harmful. While vasoconstriction can be helpful in certain situations, too much of it can have serious health consequences. Here are some potential problems linked to excessive vasoconstriction. Acrocyanosis and Raynaud's phenomenon. In these conditions, excessive narrowing of blood vessels in the fingers and toes can lead to bluish skin, numbness, and even tissue damage due to reduced blood flow. Increased risk of heat stroke. In cases of hyperthermia, vasoconstriction can exacerbate the problem by trapping heat inside the body, increasing the risk of heat stroke. Heart issues in stressful situations. For people with coronary artery disease, vasoconstriction during times of stress can reduce blood flow to the heart, raising the risk of heart attacks or other cardiac events. Pulmonary hypertension. Excessive narrowing of blood vessels in the lungs can lead to dangerously high blood pressure in the pulmonary arteries, affecting the heart's ability to pump blood. Reversible cerebral vasoconstriction syndrome. This condition can cause severe headaches and is linked to sudden, reversible narrowing of blood vessels in the brain. What causes vasoconstriction? Vasoconstriction can be triggered by a variety of factors. Medications. Both prescription and non-prescription drugs, including decongestants and cold medicines, can cause blood vessels to narrow. Medical conditions. Some diseases, such as Raynaud's phenomenon, directly affect blood vessel function, causing vasoconstriction. Psychological stress. When you're stressed, your body releases hormones like adrenaline, which cause your blood vessels to constrict. Smoking. The chemicals in cigarettes can trigger vasoconstriction, making smoking a significant risk factor for cardiovascular diseases. Cold exposure. When you're exposed to cold temperatures, your body naturally triggers vasoconstriction to conserve heat. Diet and vasoconstriction. Surprisingly, what you eat and drink can also influence vasoconstriction. For people with high blood pressure, avoiding certain foods and beverages can help reduce the risk of harmful vasoconstriction. Caffeine. Found in coffee, tea, and energy drinks, caffeine can cause blood vessels to tighten. Salty foods. Diets high in salt can increase blood pressure and promote vasoconstriction. Processed meats. These often contain high levels of sodium and should be avoided by those prone to high blood pressure. Treatment for vasoconstriction. The good news is that vasoconstriction is usually temporary and can be resolved once the trigger is removed. For example, when you warm up after being in the cold, your blood vessels naturally vasodilate, or widen. However, if the vasoconstriction is caused by a medical condition, prescription medications might be necessary to help relax the blood vessels. What you can do at home. Here are some tips to help manage or prevent excessive vasoconstriction. Reduce stress. Practicing mindfulness, meditation, or yoga can help lower stress levels and prevent stress-induced vasoconstriction. Avoid caffeine. If you're prone to high blood pressure, cutting back on caffeine can help keep your blood vessels relaxed. Exercise. Regular physical activity promotes vasodilation, especially when you warm up before exercising. Quit smoking. Stopping smoking can significantly reduce your risk of cardiovascular problems linked to vasoconstriction. When to see a doctor. While vasoconstriction is a natural bodily process, certain symptoms should prompt you to seek medical help. These include hyperthermia. If your body is unable to regulate its temperature and you feel excessively hot, vasoconstriction may be making things worse. Pulmonary hypertension. If you experience shortness of breath or chest pain, consult a doctor immediately. High blood pressure. Chronic high blood pressure is a serious condition that requires medical management to prevent dangerous levels of vasoconstriction. A final note from Dr. Mai. Vasoconstriction plays a dual role in keeping you safe and warm, but too much of it can lead to serious health problems. While you can't avoid vasoconstriction altogether, you can take steps to minimize its harmful effects by managing stress, limiting caffeine, and staying active. If you have concerns about your blood pressure or vasoconstriction, be sure to speak with a healthcare professional. And don't forget to subscribe to the channel, like this video, and comment below to support our channel and learn more about important health topics like this. Thanks for watching.